The North Carolina Institute for Public Health is my favorite part of the Gimming School of Public Health because it's the part of the school that really makes a difference in the lives of everyday North Carolina people.
We do some of the behind-the-scenes work that helps strengthen the skills and capacity of all of the public health professionals in the state, whether it is an enhanced role nurse in a local health department, a local health director, or somebody working at the state.
Really exciting to have the opportunity and a mission to serve our state, and then the really cool things we learn even take them beyond our state.
We have an extremely committed group of people who are truly driven by the mission of trying to achieve that really important goal of making sure that all people in a community have the opportunity to be able to be healthy throughout their lifespan.
It's such a blessed opportunity to be able to look at a need and work with good people both in state and nationally to develop something to try to address it in real time.
We're able to learn about what they do, identify their needs, and honestly work with them, partner with them to meet those needs. And I think that is an awesome position to be in because we get to not be consultants, but we're partners.
The outstanding staff and their commitment to communities and building that capacity for local public health departments when you're in areas particularly that might have less resources or not as much opportunity for promoting and enhancing public health. I saw where the Institute for Public Health really did have a positive impact on the staff, helping them build capacity in their own communities.
We do a lot of blending of the collecting the data, but also helping people figure out what to do with that data. We refer to kind of data to impact a lot of the times. We really want to emphasize that data is cool and data is important to drive decision making, but data should never just sit there.
The social determinant of health work that we do, I think, shines a light on areas that are experiencing the greatest inequity.
Who else do you know around here that can do the mapping that our group can do? So I think that's really critical. I like how it all plays into all the social determinants of health and all the key issues that affect so many counties and communities across North Carolina. And we're in the middle of it.
As we have our community engagement projects, we're able to involve students and provide those more practical experiences and get the students out in communities in North Carolina.
I actually got a chance to go out into the community and administer this survey door to door. I really enjoyed it. I enjoyed getting to meet new people. I enjoyed learning the wants and needs of community members.
Some of the work that we're doing with public health department leaders is trying to expose them to take on that challenge of trying to promote equity in their communities. It definitely involves things that some communities don't have even open conversations about yet.
The National Health Equity Research webcast is Gilling's answer to an unmet need, and a lot of people are not elevating racism and health disparities in a way and looking at it in a way that it relates to public health, and it has everything to do with public health. So it's answering a call and giving students and community members an opportunity to say, this is what we're seeing in our community. How can we affect change as practitioners? How can we affect change as students? What does this look like?
being in an institution like UNC, we also are connected to great researchers and evidence-based practice. And so we have the opportunity to kind of get some good information on what may happen to public health in the future and be able to position our partners and provide training and technical assistance and consultation to them to not only be responsive to what they think they need now, but also to position themselves for where they very well may likely need to be in the future.
I love the idea of us thinking of ourselves as a system to support the public health workforce in the state.
At the beginning of the Institute, we used to say, serve the state, lead the nation. And we've learned a ton about what's possible in local public health from the people that we recruited and have funded and have supported. And that all comes back here. That all comes back to North Carolina.
The Institute has maintained its vision and its focus of engaging on those issues, citing where are the needs, continually to do the surveillance, I guess you'd call it, and then coming up with creative ways to meet those needs.
Their expertise in training the workforce of North Carolina can expand across the country.
I believe the Institute is in the perfect space to be involved and engaged and have a real positive impact and help local communities across North Carolina and beyond.